can you postulate how LDN modulates the cannabinoid system, especially in relationship to the emerging evidence of suppression in Parkinson's patients?
It's really unique how, as we reclassify these receptors and how their overlap shows up. And so Dr. Kim, he actually pointed out that PEA, which is found to have this modulating impact on TLRs, is the mother molecule of all endocannabinoids. And so we know that there is this overlap synergistic sort of type response. We also know that with Naltrexone, it may not directly interact, but it has this sort of feedback regulatory aspect. And so it's a synergistic response. We also see it in literature where we're combining, say, CBD with LDN in cancer patients, and we're seeing better uptake of chemotherapeutic drugs. There's this beauty in overlap. The TRPM receptors are now classified as endocannabinoid receptors, and we know naltrexone works in them. So we don't fully know all of the impacts, but we do know that that information, as it's gaining, we see this sort of, yes, we can see this balancing act. So to the point, we don't have all of the picture, but we're gaining clarity. And it's generally a synergistic, beneficial response until the doses get too high. And then all of a sudden we're into a different conversation. So, and that's the same thing with too much THC, which we do see, or not enough CBD THC balancing. And this is a conversation we were also having about full spectrum versus single entity products. And so with the CBD world, we do want to see that full spectrum. So, but in the compounding world, we're not allowed to compound with those products. I have to be clear.
Right.
Regulatory aspect, we're allowed to carry them in the pharmacy, but we're not allowed to compound them and put them into any other products. And so just rub it on your, just get the pharmacy to turn it into a cream. It'll be fine. We're not legally allowed to do that. You can't do that.